Let's think about your mouth for a second. Yeah, we know it's for eating and talking, but what if I told you it's also a battlefield, a front line where some of the very first clues about your internal health start to show up? Today, we're going to decode the battle happening inside your mouth, and you'll see what it can reveal about the rest of your body.
So this is really the big question for us today. And trust me, the answer goes way, way beyond just cavities or bad breath. We're talking about major clues that point directly to the health of your entire immune system.
To really get this, we have to stop seeing the mouth as just an opening and start seeing it for what it is, a battleground. It's this incredibly complex ecosystem, and when things get thrown out of whack, it's often one of the first and clearest signs that our body's main defense force, our immune system, is in some kind of trouble. And this, right here, is the key. We're all so trained to listen for a cough or check for a fever when we feel sick, but what we often miss are the signals that can show up way earlier, written right there in plain sight on our gums, our tongue, and our lips.
Okay, so our first battle starts with a pretty straightforward enemy, an outside invader. In this case, we've got aggressive bacteria launching a full-on assault against the gums. The official name for this is necrotizing gingivitis.
So what exactly is this? Well, it's a super severe bacterial infection, and no, it's not contagious. Now, we've all probably heard of gingivitis, which can be kind of subtle. This is not that. This is on a whole other level. We're talking intense pain, bleeding gums, and actual ulcers forming. It is not a minor irritation. It's a serious attack.
And here's where the story gets really fascinating. This condition has a nickname you might have heard of, trench mouth. And yeah, it comes straight from the history books. It was everywhere among soldiers in World War I who were dealing with, just unimaginable stress and awful conditions. And that's the real clue here. The disease didn't just pop up because of germs. It showed up when the soldiers' bodies were too worn down to fight back.
And that really gets to the heart of it. The bacteria, they're just opportunists. They can only get a foothold when our defenses are already down. I mean, look at this list. Things like major stress, smoking, not eating well, they don't directly cause the infection. What they do is they basically leave the front gates wide open for the enemy to waltz right in.
But what happens when the enemy isn't from the outside? What if the attack is coming from within? Well, that brings us to our second kind of battle, autoimmune disease. This is where the body's own defense system gets confused and starts attacking itself.
The best way to think about this is friendly fire. Your immune system, the very thing designed to protect you, gets its wires crossed. It starts flagging your own healthy cells as foreign invaders and launches a full-scale assault against them.
We're going to focus on two very different autoimmune diseases, where the mouth becomes a primary battleground. In pemphigus vulgaris, the body attacks the literal glue that holds your skin and mouth lining cells together. And then you have Sjogren's syndrome, which goes after the body's moisture factories, the glands that make saliva and tears.
And the result of this friendly fire, it's devastating. These images show what happens in pemphigus vulgaris. Because the body is attacking its own cellular glue, these incredibly fragile blisters form in the mouth and on the lips. They pop almost immediately, leaving behind these raw, painful sores that can make something as simple as eating or talking just agonizing. Now, what's absolutely crucial to understand is this number right here, 50 to 90%. That's the percentage of pemphigus vulgaris cases where these painful sores in the mouth are the very first sign of the disease. They can show up months before anything appears on the skin. This means dentists and oral hygienists are often the first line of defense in spotting this serious condition.
Okay, our second example, Sjogren's syndrome, is a much more stealthy kind of attack. The immune system isn't making blisters here. Instead, it's systematically shutting down the body's ability to create moisture. And this leads to this relentless, progressive dryness in the mouth and eyes, a condition that can just completely change a person's quality of life.
So how do doctors pin down such a stealthy disease? It's kind of like a three-step investigation. First, they listen to the patient's story, that constant feeling of dryness. Second, they run blood tests, looking for the specific fingerprints of the attack, which are these things called autoantibodies. And finally, for the definitive proof, they take a tiny biopsy from a salivary gland to look for direct evidence of the immune system's siege.
So how do doctors tell these different battles apart? I mean, correctly identifying the enemy is always the first step to creating a winning strategy, right? This is where diagnosis is absolutely everything.
This chart lays out the different battle plans really nicely. So look at that top row, necrotizing gingivitis. It's a clear-cut case of a bacterial invader, and you can diagnose it just by looking at the gums. Now compare that to the 2 rows below it. Pemphigus and Sjogren's are both internal autoimmune attacks, but their main signs are totally different, blisters versus dryness, and figuring them out requires a much deeper investigation, with tissue samples and biopsies.
And this right here, this is the smoking gun. When a pathologist looks at that salivary gland biopsy from a Sjogren's patient, this is what they're hunting for. You see that dense purple cluster of cells? That's called a focus. It's basically a mob of immune cells that have invaded the healthy tissue where they don't belong. Finding enough of these clusters is the definitive proof that an autoimmune attack is happening.
All right, so once the enemy has been identified, the whole focus shifts to the counterattack. The goal is remission, and the strategies have to be perfectly tailored to the specific type of fight.
And it makes perfect sense, right? Different battles need completely different weapons. To fight the outside invader in trench mouth, you attack it head-on with antibiotics and a really good professional cleaning. But you can't use that same strategy for autoimmune diseases. For pemphigus and Sjogren's, the problem is friendly fire. So the goal is to get your own army to stand down. And that means using drugs that suppress the overactive immune system, basically telling it to call off the attack.
So what's the big takeaway from all this? It's that your mouth is doing a lot more than just chewing and talking. It is constantly telling a story about your overall health, and it's reflecting these hidden battles that might be going on inside you. The key is to learn how to listen to it.